All right, few surgeries strike kind of anxiety in the hearts of patients, quite like hearing spinal surgery, right? Despite their level of pain or injury, most are hesitant to go to such an extreme, which is why I'm fascinated to hear what my next guest has to say about minimally invasive spinal surgery. So here to explain, we have Dr. Ranjit Ganguly with OrthoNeuro, the sponsor of this segment. So good to have you on.
Thank you, Robyn. Happy to be here.
All right, so when we talk minimally invasive, that is not something that you automatically think of when you think of spinal surgery, right?
Correct, yeah. Yeah, traditional spine surgery, if you imagine, if you feel your back, you can feel one little tip of bone, but then your spine is basically, the spine bone is basically encompassed by a big block of muscle. So typical open spine surgeries, in order to access the spine, you have to open the skin, really dissect and free up a lot of that muscle from the spine just in order to access the spine. Minimally invasive spine surgery allows us the ability to access the spine without disruption of the muscle.
Okay, and that's probably huge when it comes to recovery, when it comes to the actual procedure too, right?
Absolutely. So the recovery time for minimally invasive spine surgery is much, much quicker. Obviously, because of that preservation of the muscle, of the soft tissue, there's much less postoperative pain. Some of these procedures can even be done in an outpatient setting, meaning you're able to have your surgery and go home walking, feeling much better, pain relief the same day of surgery.
Wow.
So it's really been a shift in the mindset in spine surgery and of spine surgeons being able to offer this to patients.
So what types of injury, what type of ailments would fall under this? Because we know a lot of people struggle with different varieties of back pain, right?
Correct. So minimally invasive techniques can be employed, can be utilized to treat a variety of spinal conditions. These include stenosis, or pinching of the nerves, instability, as well as things even such as spine tumors or infections of the spine. So really the ability for minimally invasive surgery is pretty, it's a pretty vast network of things that we can offer in terms of conditions to be able to treat it in a minimally invasive fashion.
Okay, so kind of on that same end, but are there certain patients who respond better with that? Are there certain patients who are going to say, I didn't want to be under the spinal surgery with the drastic recovery, now this is something I can do?
Right. So historically, patients who have larger body habitus or who have struggled with obesity, they've been unable to undergo spine surgery. Sometimes in some patients, minimally invasive approach can be used to allow them still the opportunity to get some relief. Additionally, patients who are elderly or who have more severe medical conditions, they may be a candidate for minimally invasive surgeries because the stress and strain on the body and the recovery period is less. So it's not a cookie cutter approach, and I always say every patient is different.
Right.
Every patient has unique characteristics and medical history that need to be explored and need to be uncovered before determining who is going to be a candidate for this, but it definitely provides us another opportunity or adds some thing in our armamentarium to be able to offer patients who have spinal conditions the ability to get some relief.
And I imagine you telling a patient, too, that this is an option is probably a huge relief when they hear, spinal surgery, right? They think of that drastic measure that you talked about and saying, we don't have to interrupt your life.
Correct, yeah. So a lot of patients, they have a big fear of spine surgery, and they may have had some poor stories that they've heard, but minimally invasive approach obviously is just that, and the goal of that is to accomplish the same goals of an open traditional approach, however minimizing the recovery time, minimizing the tissue disruption, and getting people back to having a high quality of life faster.
And that's important to note. You're saying it's not as if we're only doing half the work. That is why you're getting a minimally invasive procedure. We are doing the same thing, just very less intensely.
Correct.
Right,
so
to the body.
Absolutely. In minimally invasive approach, we have to be very deliberate and very purposeful because we're making very small incisions. We're making basically a minimal footprint on the spine. So we still accomplish all the goals of surgery, whether it be to decompress the nerve that's pinched, whether it be to put the rods and screws in, hardware to stabilize the spine. all of the goals of surgery are the same, but just the amount of tissue disruption is much reduced in order to preserve the muscle and the soft tissues.
Yeah, the integrity of the spine. Okay, doctor, I want to let people know then where they can find you, which OrthoNeuro offices you operate at.
Absolutely. So I'm based out of New Albany locations as well as Pickerington and Grove City.
Okay, all right, and you can always go to the website, the phone number there on screen as well to find a location near you. Doctor, thank you for being here.
All right, thank you so much. Appreciate it.